Hello and welcome to For Kids' Sake with Dr. Lance Chilton. I'm your host, Rosalinda Roman. I am the mother of three, and I love this show because we ask lots of important questions to pediatrician Dr. Lance Chilton. Today's topic is childhood diabetes. It is a hot topic in the news, and we're going to talk about the links to obesity and kidney disease as well. So these are very important things to discuss. Hello, Dr. Chilton.
Hello, Rosalinda.
How are you today?
Nice to be with you.
Good, good. So we, when you turn on the news and you hear about obesity, it seems like diabetes is an epidemic in this country, really.
Yes, it certainly is. We are seeing more and more diabetes, and of course we're seeing an awful lot of obesity in children. Parents are finally getting the idea. So whereas 10 years ago parents would say, well, my child hardly eats anything. Now they say, is he or she too heavy?
Interesting. And we've talked a little bit off camera about some anecdotes. I don't know a lot about diabetes other than I remember when I was working in Monterey, California, the news director's daughter, who was only one, had diabetes and had to wear some kind of pack on her body. And then the other anecdote I have is that my own father, he was diagnosed as pre-diabetic, and he was able to change the course of his diabetes or potential diabetes through exercise, food, diet, and medicine. So those are two very different things we're talking about, right?
They really are. They're two different diseases that end up with sugar in the urine and inability to digest or to handle the sugar load that people get when they eat.
And obesity, I know we've mentioned it, but it really is that the key cause of diabetes at this point?
It's the key cause of much of the type 2 diabetes that we used to call adult onset diabetes. Now we call it type 2 diabetes because we're seeing it increasingly in children. Type 1 diabetes, which is the kind that I'm sure your one-year-old acquaintance had, is not linked to obesity, but rather to a kind of body attacking itself sort of situation.
Okay, so for the purposes of this show, we'll probably mostly talk about type 2. One of the things we talked about before the show is that we both had some experiences with the Navajo reservation.
Yes, I think your father-in-law went to the Navajo reservation about the same time I did in the 1970s. When I was there, we had a lot of problems with malnourished children. Children just couldn't get enough to eat, and we didn't see any diabetes. Now the doctors who are there see very little malnutrition, fortunately. That's a good thing. But they also see a lot of overweight children who are likely to become diabetic later on.
And what do you attribute that to?
Well, I think the availability of fast food and cheap but high-calorie, low-nutrient food on the reservation.
So you go from potentially a population that doesn't have enough food to a food that maybe not be best for their body type.
Right. We talk about dysnutrition, meaning not the right kind of nutrition, rather than malnutrition, not enough nutrition.
And we're going to get further into this conversation. You're going to bring on expert Dr. Michelle Zara. She's a pediatric endocrinologist at Presbyterian Medical Group. So coming up in the next segment, we're going to talk with her. But later on in the show, you're also going to talk with a medical resident on this same topic.
Yes, both of these people are experts in different parts of the diabetes picture.
So that's very helpful. And then we end up the show with a visit to the library, one of your favorite projects, to talk with parents.
We'll get to answer some questions that come sort of spontaneously from the parents in the library.
It's a fun segment. I hope people will stick around for that. So diabetes, obesity, we're going to talk a lot about that, and then we'll get to some questions in the library. So I hope everyone sticks around. Again, we're going to have Dr. Chilton and Dr. Michelle Zara talking about diabetes after this break. So I hope you don't go away because you'll miss a great conversation. Stick around.
A full life measured in seats starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
It was about my research.
Welcome back to For Kids' Sake. According to the Centers for Disease Control, childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. Those are scary statistics, and it is a hot topic that we really need to talk about because obesity is a number one contributing factor to that change. Joining us today to talk on the subject of obesity and diabetes and all things relating to the subject of diabetes, we have Dr. Michelle Zara here with, of course, Dr. Lance Chilton.
Dr. Zara, thanks for joining us on the show today.
Thanks for inviting me.
Well, you're part of pediatric endocrinologist that is growing.
Right.
First of all, I suppose we should define what an endocrinologist is and
I was
what
going to
they
say that
do.
would help.
So a pediatric endocrinologist is a doctor who's specialized in caring for children with hormonal disease or endocrine disease. So that encompasses, diabetes, obesity, bone disease, growth problems, puberty, sexual differentiation disease. So it's very complex, and the hormones are substances are secreted by glands and that go all over the body to tell the tissues what to do with it. So it's very vast and very complex thing.
So these hormones are sort of the controllers of the body.
Right, they control a lot of our body functions.
Well, today we're talking about diabetes in particular, which makes up a certain proportion of your practice. Are you seeing more diabetes now than your practice did a number of years ago?
Absolutely. Unfortunately, the rise, I think, in type 1 diabetes over the last 10 years is 21% prevalence. And then in type 2, some practices see about 8 to 46% of type 2 diabetes in their practice, other pediatric endocrinologists. So both are rising.
So we used to say that what we now call type 2 diabetes was adult onset diabetes, but it's not just in adults anymore.
No, unfortunately, the age group, the most prevalent with this is 10 to 19, but as the population is getting heavier and heavier, we even see younger children with type 2 diabetes.
So we've already talked about it, and you've already led into the discussion. We're seeing more obesity, and that, to your mind, is that the main cause of the increase in diabetes?
No, because both types of diabetes are increasing. But to quote a movie that I just saw called Fed Up, that everybody should go see, it's playing in theater in Albuquerque. It's a report on obesity in America. It's a documentary. In 1980, there were no cases of type 2 diabetes in children. And now in 2010, there is 500,000 children in America with this condition. So
Wow.
Both are increasing. Probably the type 2 is going to surpass the increase of the type 1 if we don't get very proactive in preventing.
Well,
And-
that's a
I'm sorry to interrupt. I just wanted to, for viewers who might not know about diabetes, what are the side effects or what are the other effects that come from having diabetes? What is that? What is diabetes?
Well, diabetes is a disease where the sugar that is absorbed through your intestine is not able to be absorbed by your cells. In order for the sugar to be used in your cells, you need insulin. And if you're insulin deficient, like in type 1, or if your insulin doesn't work well, like in type 2 diabetes, your sugar cannot be used by the cells to give energy to your body. And then you start accumulating the sugar in your blood, and you start peeing a lot, drinking a lot, vomiting, getting extremely sick.
Wow.
So that's what you see when people have
The
onset
disease.
of diabetes,
Yes.
and sometimes
And weight loss, because you get dehydrated.
weight loss sounds like it would be good, but it isn't
No,
in that case.
It's almost like your body is starving, it
Your
seems.
body is starving, yes. It's a form of malnutrition. Absolutely.
Well, we talked before you came on a little bit about the fact that that we may see a decrease in life expectancy due to diabetes and obesity. Why is that? What about diabetes leads to earlier death?
Well, in children that are in type 1, who have type 1 diabetes and are doing very well in good control, we see sometimes a totally normal life expectancy free of complication. This is not the rule, but we can see that with good management. In children with type 2, if they don't change their lifestyle or do take their medication, and they can get kidney disease and end up with kidney failure, renal dialysis. They can get heart attack. They can get the clotting of the arteries and the vessels.
For children.
For children. I mean, that would happen probably several years down the road. You know, that's why we rarely see it in our patients, because we see kids until 20 or so. But you would see that maybe after poor control, maybe 5, 10, 15 years down the road. So if you prevent that, you can really improve your quality of life and have a very good, healthy, productive life.
So that's a good question. What about prevention? What can we do?
So prevention for type 2 is mainly, you know, lifestyle changes, eating better food, if possible, cooking your food at home, because the processed food is being enriched with a lot of sugar and other bad things for your body. And also, you know, exercise. When I was growing up in France, but even in the States, I'm told, physical education was everyday almost occurrence. And now I have some children who have 1 hour a week or none. And this is a very poor circumstance for prevention. And also the food that we feed our children has become mostly fast food. You can go to a cafeteria and look at what is served, and you'll see sometimes pizza, burger, and fries, and all that. So we need to be mobilized to make change and to want to change things. Not only we have to do that at home, but in the school, some children only get their 2 meals a day at school. And it's very important that this, all this change. And then the parents have to show the good example to their children.
So the parents need to eat well-balanced meals that are not just junk food.
Exactly.
And that is true, well, the children's diet helps avoid obesity, avoid diabetes in the first place, and also helps people who have been identified as having diabetes and then need to change their lifestyle.
It helps if you eat better. I'm not saying you should never have fast food, but I mean, you should make it a once a week occurrence, and you should choose selectively, you know, but not in the cafeteria, not for breakfast, not every day.
Rosalinda mentioned earlier on that, that her coworker had a 1-year-old with diabetes who wore a piece of equipment all the time. Technology has gotten to help diabetics too, right?
Right, but technology can only help if you still have to have the human input. In order for the insulin pump to be effective, you need to enter the carbohydrates that you have consumed, and you need to be able to override the technology when there is a pump malfunction. So I believe technology helps, but right now we're not in a situation where the technology can do everything to make the patient better. You need to learn the tools to take care of that technology.
Well, it sounds like we could talk about this all day, and it sounds like the number one thing you are both saying is that patients need to get involved and be advocates and take care of themselves. So I wish we could continue. Thank you, Dr. Zara, for joining us. It's such an important topic. And we'll continue the topic when we return. Dr. Chilton and Dr. Jenny Camacho are going to continue the discussion on diabetes. Don't go away.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Welcome back to For Kids' Sake, and we had a great conversation about diabetes in the previous segment, and we're going to continue that with some discussion, including kidney disease in children and chronic kidney disease and how that can affect behavioral and learning for kids.
Right. As I mentioned on a previous show, our residents do great work in many different ways. Jenny Camacho, who is my interview subject coming up here, is doing research not on children actually, but on adults with diabetes and kidney disease. And we're talking to her about kidney disease as it develops as a complication of diabetes.
All right, let's listen in.
I'm here with Dr. Jenny Camacho. Jenny, thanks very much for joining us today. Tell us a little bit, if you will, about the research you're doing on diabetes and kidney disease.
Yeah, sure, of course, Lance. It's mainly looking at the pre-diabetic state in adult patients. So I have a couple studies going on. One study was looking at the kidney's ability to filter well before the overt onset of diabetes. So we were looking at mainly something called the estimated glomerular filtration rate, which basically tells you how well your kidneys can filter your blood. And so some studies have shown that before you have the overt onset of type 2 diabetes, the kidneys actually go through this hyperfiltration state where they really start to filter and overfilter. And so that was one of the things that we were looking at. And we looked to see if there was an ethnic difference between Hispanics and non-Hispanic whites. And we weren't actually able to find that. The other aspect of my study looks at the hemoglobin A1C, which is a test that tells you your overall glucose control over about a 3-month period. Looking at that versus the standard test that we've used to diagnose diabetes, which is the oral glucose tolerance test, where patients have to drink this 75 grams of glucose, and then we test their glucose at different intervals after they take that glucose load. And so when you compare those two methodologies of diagnosing diabetes, we were looking to see if those in fact would diagnose the same amount of patients with prediabetes and diabetes. And what we actually found is that those two methods don't actually agree.
Now you mentioned that you're testing people with prediabetes. Does that mean you have a crystal ball?
No, it doesn't mean that. It's just that when you there's this pre-diabetic state that you have where your body isn't able to either produce as much insulin as well, or you're not able to actually be sensitive to the insulin that your body can produce. So it's not a crystal ball, but if you can figure out when people are in this pre-diabetic state, then you can maybe change their lifestyle and change a few things so that they don't actually develop diabetes.
I see. You know, diabetes has been in the news a whole lot lately. Is the incidence of diabetes increasing?
Yes, it actually is. One of the most common problems that we're seeing is that type 2 diabetes, which is traditionally, like 2 decades ago, we were seeing that mainly in adults over age 40, but now we're actually seeing that in children and at younger and younger ages. A lot of that's due to this obesity epidemic that we're experiencing right now as a country. But I think a lot of it too is that we're more sensitive to type 1 and type 2 diabetes and know how to diagnose them earlier on.
And is the type 1 or type 2 associated with kidney disease?
Actually, both types are. and really, mainly with type, both types are really associated with kidney disease. It just matters, your overall glucose control really determines whether or not you're going to develop kidney disease or not.
That sounds like it's a very important fact for diabetics to know, that if they control their diabetes, it will improve the likelihood of their not getting kidney disease?
Yes, definitely. Well, the thing is that diabetes in general, whether it's type 1 or type 2, is really a problem with the really small vessels. The microvasculature is what we call it. And so when you look at that, it's not only associated with the kidneys, it's associated with the eyes, it's also associated with the nerves. So the main problems that we see long-term with diabetes are kidney disease, eye disease, and then something called peripheral neuropathy, where people have pain and really heightened sensation in their lower extremities.
And are all three of those susceptible to improvement if you improve the sugar control?
I think if you catch them early on and you're really aggressive about your glucose control, but a lot of times, if you've been in really bad control for a particular amount of time, then there's only so much you can do. Kind of once neuropathy is set in, you can, I think, stop the progression, but once it's done, it's kind of done. And that's the unfortunate part about type 2 diabetes and type 1 diabetes, is that if you don't remain in good control and continue to remain in good control, then you're kind of setting yourself up for, complications down the road.
Now, you and I are pediatricians, and we're talking about a disease, or at least the manifestations of disease that will show up as adults. What should we as pediatricians do to prevent diabetes or to prevent kidney problems?
I think that the main thing that we can do as pediatricians is really educating our families, educating parents, being that good support network that they need, getting them, involved in the community. There's always diabetes support groups. Most cities have diabetes camps that kids can go to. I'm sure there's kidney disease camps, because kidney disease is not only secondary from diabetes, but there's a myriad of things that can cause, chronic kidney disease. But when we're looking at it just from the diabetes and kidney disease aspect, I think just educating families about staying in good glucose control and making sure that they understand that every decision that they make, it's an everyday process, it's an every meal process. Are they going to help their kids count their carbs and do their insulin and check their blood sugars and things like that?
Takes a lot of care to take care of a patient with diabetes. Thank you so much for joining us today and talking about your research. It's wonderful that you can do that.
Well, thank you so very much for having me. I appreciate it.
And when we come back, a face-to-face Q&A between Dr. Lance Chilton and parents out at the library. Don't go away.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
I'm sorry, so this is the beginning of the library pictures. Yeah, okay,
So as a prominent pediatrician here in New Mexico, I imagine you have lots of questions from parents about their kids and their kids' health. How do you get out there to the parents?
Well, many of them show up in my office, of course, but also I like writing my column and I like going out to the community and answering questions when they come up.
And you do that, this segment is all about going out to?
We're going out to the Tony Hillerman Library and talking with kids and, well, talking with parents anyway about their kids.
So let's check that out.
Okay, with summer coming basically right around the corner, what is your take on sunblock as opposed to something that's made with like carrot oils and whatnot? Because I've heard so many bad things about sunscreen, and my kids are 3 and 5, and they're very, very fair-skinned, and I don't want them to get burned, but I also at the same time don't want to use sunblock or sunscreen. What should I do?
Well, it's a terrific question, particularly for this time of year. When I go out and ride my bike, as I did coming here, I have to put on sunscreen because I'm kind of light-skinned myself. And I don't want to get skin cancer,
Right.
and that's what we're trying to prevent. So the things that you can do about that are, first of all, to avoid sun, but you don't want to do that.
No.
Here it's so nice in Albuquerque in summer. We want to be outside and swimming and bicycling in my case, or walking or whatever. Wearing a hat, like the little boy's hat who just came over here, that'll help, especially if it's bigger and covers more of his face. Wearing clothes that will block the sun, and most of our clothes do block most of the sun, but not all of it. So that's useful as well. Long sleeves, long pants, even though it's kind of hot for that in Albuquerque in summer.
Yeah.
And then I don't really feel that there's any problem with sunscreen. I think it really is life-saving in some respects, but also makes you feel better about being outside, and so I think you should do it. It used to be that pediatricians said you couldn't use it before age 6 months, but really now we recommend it for all ages if they're going to be outside for very long. Here in Albuquerque, because we have so much sunlight, you don't have to be outside very long to get a sunburn. It's if you're talking about noon, it's probably 10 minutes. So if you're going to be outside for more than that, use all those methods to try and prevent yourself from getting sunburn.
Okay. Thank you.
Great question.
Thank you.
Well, I love the question about sunblock because my kids and I spend so much time at the beach down in Mexico, and I'm always wondering about that. How much is too much? And more importantly, I've heard that you need to get some vitamin D in your system.
We don't need to worry too much about vitamin D in New Mexico because we're exposed to the sun so much here unless we live in a cave. So we need to be guarding against the bad effects of too much sunlight.
So yes to sunscreen.
Yes to sunscreen.
Yeah.
Yes to covering up.
And yes to also making everyone up north jealous
Yes,
about our sun
absolutely.
all the time. So if people can't make it out to the library, which you will have more library programs, so I hope they will come out to that, but if they can't, how else can they reach you?
Well, I have an email address, and I'm glad to answer questions. You'll find my email address at the end of my journal column. And we have a Facebook page for this program, so take a look at that and send me a question.
Yeah, I think that it's really nice for people to be able to have access to you, to ask those questions directly. Sometimes the library setting is perfect, and sometimes they may be a little shy, so Facebook may be a good way.
Well, the library has so many wonderful programs that I won't be at all of them.
Okay, good. Well, I appreciate you sharing all of your knowledge with us, and Dr. Zara for joining us. And I hope you guys will join us for a future For Kids' Sake, because it really is great information direct from Dr. Chilton and the experts. So thank you for joining us. I'm Rosalinda Roman. Until next time.